Welcome to Module 2, Infection Control and Personal Hygiene. You're going to master the skills that separate professional caregivers from the rest. You're about to learn how to become an infection-fighting superhero. Let's start with a reality check. Right now, your hands are carrying over 150 different types of bacteria. That's not a problem. That's biology. The problem comes when we transport these microscopic hitchhikers to vulnerable patients. Pause here and look at your hands. Can you see any germs? That's exactly the challenge we're facing. Reality check. A single unwashed hand can harbor over 150 different bacterial species. Healthcare-associated infections affect 1 in 31 hospital patients daily. 80% of infections are transmitted through contaminated hands. Proper hand hygiene can reduce infection rates by up to 50%. Remember, you're the circuit breaker in the chain of infection transmission. Your superpower awaits. Imagine having the power to protect every life you touch from invisible threats. Today, you'll master the two most powerful weapons in healthcare: hand hygiene and proper glove technique. These aren't just procedures, they're your professional superpowers. By the end of this course, you'll confidently prevent infections and protect vulnerable patients with precision and professionalism. Take note of the invisible enemy. These are the threats: bacteria, viruses, and fungi. Because they are invisible to the naked eye, survive on surfaces for hours, spread through direct contact. Every surface you touch, every person you help, creates an opportunity for germs to jump aboard and travel to their next destination. You control that journey. The Wash Me Protocol, exam essential. This isn't just a memory aid, it's your professional commandment. Perform hand washing when arriving at client's home, after body fluid/contaminated surface contact, surrounding personal care tasks, before and after, handling waste, trash, or soiled linens, moving between dirty and clean tasks, eating or exiting restrooms, or before break. Always keep in mind the Wash Me Protocol. Pro tip: if you're questioning whether to wash, wash. Uncertainty means contamination is possible. The 6-step hand washing ritual, heavily tested. Equipment needed: soap, warm water, clean paper towels, 20+ seconds of your time. The technique: 1. Wet. Activate the cleaning process with warm water. 2. Soap. Apply enough to create rich lather. Soap molecules literally grab germs. 3. Scrub. 20 seconds minimum, hitting these critical zones. Palm to palm in circular motions. Between each finger, interlace and slide. Back of hands with palm friction. Fingertips and undernails, make tiny circles. Thumbs, wrap and twist with opposite hand. Wrists and forearms if contaminated. 4. Rinse. Let gravity pull contamination away, fingertips down. 5. Dry. Pat, don't rub, with clean paper towel. 6. Protect. Use towel as barrier to turn off faucet. Memory device. In 20 seconds, sing 2 rounds of Happy Birthday or count to 20 slowly while naming body parts you're cleaning while hand washing. When do we use hand sanitizer as an alternative? When hands visibly clean. No body fluid contact. Quick decontamination. How do we use hand sanitizer? Quarter-size amount. Rub until completely dry. 15+ seconds minimum. Understanding glove psychology. Gloves create a false sense of security. Remember, they're contamination collectors, not magic shields. They protect you from them, but can spread contamination if misused. The glove decision tree. Always glove when dealing with body fluid contact, blood, urine, feces, vomit, saliva, wound drainage. Contaminated items, soiled linens, garbage, used tissues. Oral care, teeth brushing, denture cleaning, mouth inspection. Broken skin, yours or theirs, any cuts, hangnails, or open wounds. Intimate care, perineal cleaning, catheter care, wound dressing. Never glove when? Social interaction, conversation, hand-holding, comfort touch. Clean environment tasks, making beds with fresh linens, organizing. Feeding assistance, unless client has oral wounds or infections. Mobility assistance, transfers, walking, repositioning, unless contamination risk. Glove doffing mastery. The two-step doffing dance. 1. First glove removal. Pinch outside of glove at wrist level. Never touch your skin. Peel away from body, turning inside out. Hold the removed glove in your still gloved hand. 2. Second glove removal. Slip uncontaminated finger under cuff of remaining glove. Touch only the inside surface. Peel over the first glove, creating a contamination sandwich. Both gloves end up inside out, nested together. 3. Immediate disposal and hand washing. Remember, think of it as outside touches outside, inside touches inside. Never cross-contaminate. The fatal 5 mistakes that end careers. 1. Skipping hand hygiene before or after glove use. 2. Reusing gloves between tasks or clients. 3. Touching clean surfaces with contaminated gloves. 4. Improper glove removal leading to self-contamination. 5. Assuming gloves equals sterile. They're clean, not sterile. Quick recap. Key points to remember. As a PCA, you pledge to prioritize prevention over treatment, protect the vulnerable through diligent hygiene, model excellence for other healthcare workers, never compromise safety for convenience. The bottom line, infection control isn't just about following rules, it's about honoring the trust placed in your hands. Every client deserves to be safer after your visit than before it.